Bowel incontinence, also known as fecal incontinence, is the inability to control bowel movements, leading to the accidental leakage of stool. It can range from occasional leakage while passing gas to complete loss of control over bowel movements. This condition can be distressing and affect a person's quality of life, but it is treatable. Causes: bowel incontinence can result from various factors that affect the control of bowel function, including 1. Muscle or nerve damage. Injury to the anal sphincter muscles, e.g., from childbirth or surgery. Nerve damage due to conditions like diabetes, multiple sclerosis, or spinal cord injury. 2. Chronic constipation. Prolonged straining can weaken the anal muscles and stretch the rectum. Hardened stool can cause a blockage, with loose stool leaking around it. 3. Diarrhea. Loose stools are harder to control, leading to accidental leakage. 4. Rectal issues. Rectal prolapse, when the rectum slips out of the anus. Rectocele, bulging of the rectum into the vagina in women. 5. Aging. Muscle tone and nerve function naturally decline with age. 6. Pelvic floor dysfunction. Weakness or damage to the pelvic floor muscles, often associated with childbirth. 7. Neurological conditions. Stroke, Parkinson's disease, or dementia can impair bowel control. 8. Other factors. Irritable bowel syndrome, IBS. Inflammatory bowel diseases, e.g., Crohn's disease, ulcerative colitis. Rectal or anal surgeries. Symptoms. Leakage of stool, may be liquid or solid, and occur unexpectedly. Urgency to defecate, a sudden, strong need to have a bowel movement. Inability to hold stool. Loss of control before reaching a toilet. Soiling. Stains on underwear without realizing it. Gas or bloating. May accompany incontinence, especially with underlying conditions like IBS. Diagnosis. 1. Medical history includes questions about bowel habits, frequency of incontinence, diet, and medical conditions. 2. Physical examination. Examination of the anal region and rectum, checking for signs of nerve or muscle damage. 3. Tests. Anorectal manometry. Measures strength and coordination of anal sphincter muscles. Endoanal ultrasound. Assesses muscle damage or abnormalities. MRI. Provides detailed images of pelvic floor structures. Stool tests. To check for infection or inflammation. Defecography. An X-ray or MRI to evaluate rectal emptying and pelvic floor function. Treatment. Treatment depends on the underlying cause and severity. Options include 1. Lifestyle changes. Dietary adjustments. Increase fiber intake to firm up stool if incontinence is due to diarrhea. Avoid trigger foods, e.g., caffeine, spicy foods, or artificial sweeteners. Stay hydrated to regulate bowel movements. Toileting habits. Establish a regular bowel routine. Empty the bowel completely during defecation. 2. Pelvic floor exercises. Kegel exercises. Strengthen the pelvic floor and anal sphincter muscles to improve control. 3. Medications. Antidiarrheal drugs, e.g., loperamide, to reduce loose stools. Stool softeners or laxatives for constipation-related incontinence. Bile acid sequestrants, if the cause is bile acid malabsorption. 4. Biofeedback therapy. A technique to improve muscle coordination and strengthen the anal sphincter through feedback and training. 5. Surgical options. Sphincter repair. Sphincteroplasty repairs damaged anal muscles. Colostomy. A last resort procedure where stool is diverted to an external bag. Sacral nerve stimulation. A device implanted to stimulate nerves that control the anal sphincter. 6. Address underlying causes. Treating infections, rectal prolapse, or inflammatory bowel diseases. Complications. Skin irritation or sores around the anal area due to frequent soiling. Emotional distress, embarrassment, or social withdrawal. Increased risk of urinary tract infections, UTIs. Prevention. Maintain a healthy diet, high in fiber and low in irritating foods. Exercise regularly to promote healthy bowel movements. Avoid excessive straining during bowel movements. Treat constipation or diarrhea promptly. Pelvic floor therapy. for women after childbirth or anyone at risk of pelvic floor dysfunction. When to see a doctor. Seek medical advice if bowel incontinence happens frequently or unexpectedly, is accompanied by pain, blood in the stool, or weight loss, interferes with daily life, or causes emotional distress. Bowel incontinence is a manageable condition with the right diagnosis and treatment plan. Early intervention can significantly improve symptoms and quality of life.